and then let's talk about antibiotics abuse. You know my life, I don't like program it. I come on live when I have the opportunity to come live on YouTube. So today's one is not program. I'm just here to see if I have questions from my subscribers to take, if there's anybody online. And also I think student Nurse Hope will be joining us on this video so we can talk about antibiotics abuse. So for those online, kindly let us know. I think everybody's getting notification now about we are live, so they'll be coming online soon. Okay, we come in. If you're online, if you are watching, just drop in the comment section. I like it when people come and click on the like button. Just come on the comment section, click on the like button. It gives me joy to have you all watching and also liking. I'm going to be talking about antibiotics abuse. I talked about it on my Facebook page, and I decided to come here and talk about it on the YouTube channel because this is something very important and it's something we have to discuss about on our YouTube channel. Please, if you are online, just click on the like button and also share to your WhatsApp group so that everybody to come here to learn and get something beneficial from today's topic. While we are at that, if you are live, just drop in the comment section telling us where you are watching from. Your name is going to appear automatically. Just tell us where you are watching from and how long have you been following us this lecture room. Then click on the like button. We have 20 people watching, but nobody is dropping. How do I know? Can you hear me? If you can hear me, click on the like button, then drop on the comment section. Thank you very much. We have Paddington Gono. I am here from Zimbabwe. Hello, Paddington. How are you? And how is the weather in Zimbabwe? Hope Zimbabwe is fine and hope the weather is good. How are you doing, Gono? Thank you for having you here. If you're online, just drop in the comment section. Oh God, this is where I get the vibe from. Are everybody sleeping? Are they sleeping? What? Where are my followers on YouTube? Are they sleeping? Okay, Ghana James, Brother Jay from Nigeria. Thank you very much, Brother Jay, for joining our live video. We are going to be talking about antibiotics abuse on this live video today. This is a very important topic and I want everybody to be present. Please and please don't leave. This is a very important topic, like I earlier said, because there's an increased rate of antibiotics abuse and also antibiotics resistance. So we have Jennifer Clark from Guyana. Am I pronouncing it well? If I'm not, kindly pardon me. Thank you very much for having you, Jennifer Clark. While we are doing this, you can drop as much questions as you want, and I will be able to pick those questions. So we have Hope joining us to talk about antibiotics abuse here on YouTube. Hope is going to introduce himself. All right. This thing was impromptu. He actually brought the topic up for us to talk about. So we had a discussion, and he felt that antibiotics abuse is what is common, what is a common trend in especially in young youths. So he brought the question up, and we decided to talk about it. So this is Hope. Hope you can introduce yourself so that our YouTube subscribers tend to know who is talking.
Okay. Good evening, everyone. My name is Okoma de Hope C. I'm a student of Clifford University, 500 level,
Okay.
nursing science.
All right, thank you very much, Clifford. So Clifford Hope is one of our subscriber and also one of our followers on YouTube and also one of part of Nurses Lecture Room WhatsApp group. So he brought this idea about because of what he has saw, what he has seen about the abuse of antibiotics. He's in school, so pardon him. He's in his hostel, I think. So it's going to be a little bit noisy from his end. He's in his hostel, so he's a student. So pardon him if there's any noise coming from his background or from his end. Like I earlier said, he's a student nurse and he came alongside with like Nurse Messi Mary. Can we talk about antibiotics abuse? And I see this as a very important topic because there is just type Google now. Type Google antibiotics resistance, antibiotics is abuse. You see a lot of things. You see that the incidence is increasing daily. So Nurse Hope is going to be telling us what he thinks about this antibiotics abuse. Then we're going to be having an interactive section. And during this period, if you have a question, you can drop in the comment section. We are willing and ready to take all your questions. Hope, handing over to you. Tell us what you have to say.
Okay. Good evening, everyone. Once again, I want to thank you so much for having me here. It's an honor. Miss Mercy, it's an honor. Thank you so much.
Thank you very
Okay.
much.
Talking about antibiotic abuse. This topic is it has to do with most of our youths because our youths nowadays we tend to abuse antibiotics even without having a knowledge that we are even abusing the antibiotics. Most times somebody will just have a small issue, fever, headache. The person just run and go and start taking antibiotics without prescription. So the antibiotic abuse can come in different dimensions and in different ways.
Okay.
All right. So one of the ways that antibiotic abuse can be is taking antibiotics, not mesmeric, taking antibiotics without prescription. When you take antibiotics without prescription of a doctor, nurse, or a pharmacist, all right, that's an antibiotic abuse because maybe you are having an infection or you are having a disease condition. You do not know the cause of that disease condition, which normally, in a normal sense, it will be you should do a laboratory examination to determine maybe the type of infection you are having. You know, we have gram positive bacteria that can cause infections that only gram positive antibiotics can handle, and we have other infections which other bacteria can also cause. So if you go and take an antibiotics without a prescription, you do not know what you are even treating. You are just treating yourself based on what suspicion. I suspect that is a bacterial infection, and you're taking that antibiotic without even knowing the type of antibiotics you're also taking and the type of infection that you have. So when you take these antibiotics, all right, so maybe the infection in your body is not a bacterial infection. Maybe it's a fungi or pathogenic infection. Taking the antibiotics. So your body is just literally going to build resistance. All right, because even that antibiotics is not going to that antibiotic you're taking is not going to cure that even though it's a viral infection, it's not going to cure that infection because it's the only antiviral medication that can cure viral infection. And when you have maybe fungal infection, it's only antifungi that can cure fungal infections. So you shouldn't be taking antibiotics even without prescription. You need to understand the type of infection you are having, and your doctor will now, through the laboratory results, now prescribe the appropriate antibiotic that will cure that infection. So your doctor can prescribe maybe a gram positive antibiotics or gram negative or broad spectrum antibiotics that can cure that particular infection through your laboratory examination. All right. So you
Okay.
should not just blindly, out of suspicion, start taking.
From what Nos, okay, I think your network is hanging. What he's trying to let us know is that you don't take at first of all, this topic is actually broader than you can think about. First of all, you don't take
Prof, come.
antibiotics without the doctor's prescription because we know that there are different classes of antibiotics. We have the broad spectrum antibiotics, positive, negative, and sorry for going. Okay, so we have different types of antibiotics. So when you
Prof,
take an antibiotics that is
prof.
not for that particular infection, it's going to affect it. It's going to do more harm than good. Antibiotics abuse these days is on a higher side. So please and please, before you take that particular antibiotics, it's important you confirm from your doctor. Because if you continue like this, when it is needed, it will not be able to function effectively well. Hope, hope, is hope there.
Yeah, I'm here. Can you hear me?
Okay, we can hear you now.
Okay. So another form of
We
antibiotic
can't
abuse
see
is
you, but we can hear you.
okay. I don't know. Why? But my face is just here. I don't know.
I can't see you. I don't know if others can see you, but I can't see you.
What do you think I should do?
Okay. We can't see you. Even the one I'm having on my phone here. We can't see you.
What do you think I should do? My face is just here. I don't know. I don't know what happened.
Can you go over and come back again? Let's see.
Okay.
Okay. Why I'm trying to add him up again. Sorry. Okay, while I'm trying to add him up again, I'm just going to quickly take some questions that popped up. Okay, it said, people also ask what happens when you abuse antibiotics. What is an example of antibiotics abuse? Okay, Ghana James, are you here? If you are here, I want to take your question. Ghana James, if you are here, I want to take your question. Just let me know you are here so that I can go ahead and take your question so I don't end up repeating it. Ghana James, if you are here, let me take your question. Ghana James, are you here? Hope, are you here? Okay, I just want to take Ghana James' question. It says people ask what happens when you abuse antibiotics. So what happens when you abuse antibiotics is that your body builds resistance to these antibiotics. When it's needed, your body will not be able to like give the appropriate return. Let's put it that way, return it once. If you continuously take antibiotics, even when it's not prescribed, when you don't need it, you don't even complete your prescription, you don't complete your dose, your body tends to build resistance to that particular antibiotics in such a way that in the future, when you really need these antibiotics, it's not going to work. When you are taking it, it's not going to work, and you keep wondering, oh, what is happening? I took these antibiotics before, it worked, but it did not work again. So, antibiotics abuse in general simply means that you are abusing, you are taking these antibiotics even when you don't need it. Because these days, people have viral infection, some have fungal infection, some have yeast infection, and also ladies have little inching. And the only thing that comes to their mind is to take antibiotics. Mm, okay, okay, we've added you up now.
Okay. Thank you so
Okay, I'll
much. I'm
continue.
sorry. I'm sorry. It's network.
Okay, I'm just trying to answer the question before we continue. So somebody asked,
Okay.
what happens when you abuse antibiotics? I've explained that. What is an
Okay.
example of? Okay, we're going to be talking. He's going to be talking about that. Hope is going to be talking about all these Ghana James. All you just have to do is to wait to the end of the video. He's going to talk about it in general. Then somebody asked, let me just answer all the question, then you continue. Can you help
Okay.
me about my issue? My wife and I had been married for 3 years ago, but the problem is we don't have children. She's going period random, sometimes 28 days, 35 days, 4 weeks. What can I do? Paddington Gono, if you are online, just let us know before I answer that question. I just want to make sure you're online.
Okay. I'm.
Alex says from Nairobi, Kenya. Thank you, Alex, for watching. Just saying hi. I'm a medical laboratory technologist. Thank you, Alex. Thank you very much, Alex, for watching. I think Paddington Gono is not online. Hope you can continue. So, James, just listen. Hope is going to be explaining everything so you have an idea about it. So, okay, Paddington is
Okay.
online. So let me just answer him.
Okay. Go ahead.
Can you help me about my issue? My wife and I had married 3 years. Okay, you and your wife have been married for 3 years. The cycle is 28 days, 35 days. First of all, what I would advise is for her to know her cycle, which you said is 28 days and 35 days. And when a cycle is like that, it simply means that the possibility of being regular is not regular. Let's just say it's not regular. So we have to be keen in knowing her ovulation period. There are ways in which you can calculate your ovulation irregular cycle. What's going to happen? I'm going to drop a link to a particular video, not the video I made, but a particular doctor. I'm going to drop it under your comment section at the end of this video so you can watch it. For those that have irregular cycle, how to calculate irregular cycle. So I'm going to be dropping it. So when she knows her ovulation day, that is the time for both of you to be at home and have sex to be able to give birth to children. And also, if she's skeptical about her ovulation date, there's something called ovulation test kits. When you use that test kit, it's able to detect when your wife is ovulating and when to have sex to get children. All right. One thing that's more important when it comes to giving birth is knowing ovulation day, when she's releasing the egg. Once you are able to track down when she's releasing the egg, and you as a man, you don't have issues with your sperm count is not low, it's going to be easy for you guys to get pregnant and have babies. So if I answer your question, you can drop in the comment section. Then hope you can continue.
Okay, another form of antibiotic abuse or misuse is you not completing the medication. For example, you have been prescribed to take antibiotics for 7 days, and because you started taking this antibiotic, you have taken for 3 days or 4 days, and you're just using 7 days, for example. Now you have taken for 6 days, and you have seen a change in your system. Maybe you're having rashes with itching as a sign and symptom. So as you have been taking these antibiotics, because you are taking it for 6 days and the itching have stopped and the signs and symptoms are disappearing, now you suddenly stop using the antibiotics. That's an abuse. Let me just tell you what happens. When you're using antibiotics and without completing the dosage of that antibiotics, all right? Now, those bacteria, the antibiotic will be effective those times you are using it. Maybe acting on the walls of those bacteria, all right, killing them, damaging the cell walls, all right. If it is one that is attacking the nucleus, it will be attacking the nucleus. Some will be going down, all right, while some will still be fighting, all right. Now, when you stop using that antibiotics at the middle of the road without completing that medication, see what happens. Those ones that have not totally been flushed out of your system or that are not totally damaged totally will now regain their power. All right. I don't want to use potency, but they will now regain their strength. See what happens. They come back again, building a stronger immunity. They will be now building a stronger resistance to that antibiotic that you have been using. Now they will now get a diverse way in order to defend that antibiotic. They will know how that antibiotic have acted. All right. So when you take that antibiotic again, it will not be effective. The bacteria will be resistant to that antibiotic because the bacteria have understand, all right, how that antibiotic is coming to attack its existence. All right.
Yeah.
So next time when you are taking that antibiotics, the bacteria will now develop abilities, adaptive features in order to what to escape, the effect of that antibiotics, thereby causing resistance. So whenever you are taking your antibiotic, you have to complete that dosage. If it is for 14 days, if it is for 7 days, if it is for 1 month, you have to complete it because any dose missed will definitely have an effect in the sense that you need to complete your dose because if you miss any one, you are giving opportunity for that bacteria to build resistance. And also when you miss a dose, don't go and maybe when you are some people when they miss a particular dose, maybe you are taking morning and night, you miss morning one. Then you remember, I have not taken my antibiotics. You want to take two in the night. That's an antibiotic abuse. Don't try it. Don't try it. So it's only going to cause more harm than good. So that's the second one. I don't know if you have anything to say before I
Yes,
go to the
somebody
next one
said
of
thank
missing.
you. I understand better now. Okay, you can continue. It's fine.
Okay. Then the next one is antibiotics overuse. Overuse is in the sense that we are using. I want to use myself as an example. Okay, I went to a urologist and I was prescribed for one antibiotic like that, and I was asked to use it for 7 days. All right. Now, when I was using these antibiotics, I completed my 7 days dosage. All right, but I was still having some small, symptoms.
Symptom.
All right, yeah, you shouldn't continue using that antibiotic. So far as you have completed that day, that dosage that you have been prescribed. Now, see what you do. You need to report back to your what? Your doctor or your nurse or your pharmacist who prescribed that drug for you or that antibiotic for you. All right, tell him that, doctor, please, I have completed this dosage. All right, but I'm still having what? These what? Symptoms. Now, your doctor will now examine you or send you for a laboratory test to determine if whether there is a resistance of that what? That particular antibiotics in your system, if whether the bacteria are resisting that antibiotics in your system. Because when you continue to use that antibiotics, maybe the doctor has prescribed for 7 days and you continue to use it for 14 days, for 1 month, it's going to cause more harm than good. You are even giving opportunity for yeast infection, because that antibiotics will keep on acting on your body, damaging other bacteria in your system, maybe some beneficial bacteria too. And maybe there are other bacteria. So when you use that antibiotic next time, it might not be effective. If efficacy might not be as you expect. So, and that is another form of what? Antibiotic abuse.
Okay.
Do you have any other thing to say before I go down to the next one?
No question for the
Which
now.
is using antibiotics to treat.
Hope's network it's having issues. His network is having issues. He's having issues.
Okay, using
Okay.
antibiotics to treat antiviral infection.
Okay.
You can use antibiotics to treat antiviral infection. All right, because antibiotics is used to treat bacterial infections only. All right. While we have antifungi for treating fungal infections, we have other drugs like yeast drugs that used to treat yeast infections. We have other medication like pathogenic drugs that used to treat pathogenic what? Infections. So we have antiviral drugs for only uh, virus virus infections. So you cannot be using antibiotics to treat viral infection. It will never work. Drink that antibiotic from now till tomorrow, it will never kill a virus, because the virus RNA is different from bacterial DNA. It's quite different. All right. So you cannot rub Peter to pay Paul. It will never work that way. Instead, you're even causing more harm to your kidney and your liver.
Thank good.
Yeah. Because most time people will see signs, maybe there are some people they tend to have some viral infection, maybe let me just use as an example, herpes, all right, or pus, or small pus, so forth and so on. You go ahead taking antibiotics, it will never cure it, it will never flush that infection. Instead, you're even giving your other bacteria, maybe opportunistic bacteria infections that are caused by bacteria, to develop resistance to that particular antibiotics you are taking. And I hope you're understanding what I'm saying.
Yeah, I get.
Yeah, so you can never use antibiotics to treat antiviral infections or antipathogenic infections or so forth and so on.
Okay, that's
Sorry. Can never use antibiotics to treat viral infection. Sorry, please. Sorry. Or pathogenic infection or yeast infection. Just like, for example, I know ladies. This one happens among young ladies and our young men. You start having small rashes around your genital area. You do not want to show anybody because you
nobody
are
to know.
so naive. I don't know. You are so shy. You don't want people to know that you have carried infection. When you're not even sure whether it's sexually transmitted or not, you just run down to take antibiotics.
First line of action.
And yes, first line of action, because you are suspecting it's a bacterial infection already. All right. Now, when you are taking it, if it is a viral infection, it's developing more. This thing, the viral load is increasing. while you're busy taking antibiotics, and the symptoms is continue to be there. Maybe you can even manage. Maybe, I don't know what to say, but the symptoms will continue to be there. So please, you cannot use antibiotics to treat antiviral infection. And most times, our ladies, when they see small, small discharge, rashes, they run down to Ampiclox bicham.
Yeah.
I've seen a friend. Yeah, the girl, she's not having a menstruation. She had been missing her mixes for like
Period.
a month or so. So she came to me. Let me share this. She came to me. I told her, what happened. When did you now stop seeing your menstruation regularly? She said, it's been up to 6 months. So I said, what have you done? Have you gone to test? No, she had been taking Ampiclox bicham since then. She had been buying Ampiclox bicham be taken. She will take Ampiclox bicham. She will take ciprofloxacin. She will take this one. Only one person. And the thing, maybe the thing we we do as if it's coming tomorrow. It will not be there again. All right. So you think that the infection have gone. Next month you will not see the flow again. So she kept experiencing this with them. She came to me and asked me, what kind of antibiotic do I want her to take? Or do I advise her to take? I say, so you have been taking the antibiotics already, even without doing tests. Oh. She said, yes, so she have been taking Ampiclox bitter and she have taken ciprofloxacin. I said, wow, who told you, Kwame? How do you know it's a bacterial infection? She said she suspected. I said, wow. I said, wow. So please, our ladies out there and our young guys, all rashes, all discharge may not necessarily be a bacterial infection. May not necessarily be a bacterial infection. May not necessarily be a bacterial infection. So let's understand this. And also combination of antibiotics. The combination of antibiotics, like I said, we have gram-positive bacteria, gram-negative bacteria, so forth and so on. Now, each of these bacteria have a specific, a particular antibiotic that treats them, all right, that destroys their DNA and their cell walls, depending on the mechanism of action of that antibiotic, all right. So you cannot be using an antibiotic that's supposed to treat gram-negative bacteria to treat gram-positive bacteria. It will never work, not amazing. It will never work. So you need to meet your doctor, get a laboratory examination, know the kind of bacteria you are having. If it is actually a bacterial infection or a yeast infection, then they will prescribe the appropriate medication for you.
Blind treatment. I think Hope is having issues with his network.
Already scared. They're already scared. Can you hear me?
Yes, I can hear you now. It was
Okay, they're already scared that they will contact infection. Not specifically. This one is happening every day. I have one person like when she meets somebody, she will take Ampiclox bicham or any antibiotics at all, just to prevent herself. And it's not only once that you take this antibiotic that will even prevent the infection. Maybe she have sex today. She's so scared that she will not carry STI. She will take antibiotics today, and after taking it today, the person will now drop it, waiting for the next day that she will have sex. And if she has sex again,
and
she will not take the
they take
antibiotic.
just one tablet most times.
Just one tablet and relax. Okay, now
I've heard that
yeah,
too.
not the person is not. I don't know if whether I should call this ignorance or what. Yeah, it's good that the person knows that yes, antibiotic can actually help. Some antibiotic can help to cure STI, all right. But you don't know the kind of STI that you have been exposed to. Do you understand what I'm saying? That you now just blindly start taking antibiotics. Maybe you're taking Cipro, or you're taking Ampiclox, or you're taking azithromycin.
Yeah, azithromycin is not very common now.
That
Everybody's
one is everywhere and every small thing. Azithromycin, small thing, everything. Ampiclox
clarithromycin.
bicham, because it's cheap.
Medications are not. Or is it cheap now? Because when I was in Nigeria, it wasn't really cheap. It's expensive. Seriously.
Yeah,
Okay.
yeah. There are
Medications
some
are
that
not
are
really
afford-
cheap.
there are some that are affordable. Actually, there are some that are affordable.
Okay. All right. Thank you very much. I think I should add my own portion to what Nasoba
Okay,
is
yeah. Go
saying,
ahead, please.
because this whole antibiotics abuse, like it's common, but I didn't really take note of it till Nurse Hope said, Nurse Hope, actually, future Nurse Hope, let me so that they will not say, do not sue me,
Yeah, yeah,
actually
yeah,
brought
yeah.
the whole conversation to me. I was like, Nurse Miss Mary, can we have a discussion about antibiotics abuse? Then it came to my mind, it snapped like, oh, a lot of people are actually abusing antibiotics without knowing. Like, yes, they abuse. From what Nurse Hope have been saying, let me give a summary of it. The first thing he said was antibiotics abuse in the sense of you are over. What was the first? How do I put it now?
Stop using,
Huh?
not completing your medication, not
Okay, let me. I
completing.
have to follow Susan. The first one he said, remind me. I'm repeating what he said. Now, is not
Okay.
completing your medications. Like, you are not completing your medications. When the doctor tells you take antibiotics for 7 days, the doctor that prescribed that antibiotics know why he did that. So if your doctor tells you take antibiotics for 7 days, take antibiotics for 10 days, go through with that course without stopping, without any delay. Because when you do that, you are causing yourself more harm than good. When you stop, when they say take these antibiotics for 7 days, and you only take it for 3 days, you didn't kill all the bacteria. You
Yeah.
only succeeded in killing half. If it's not even up to half, it might be more than half that's still remaining in your body. Even if the symptoms are no longer showing again, you are not seeing the fever, you are not seeing the itching. As far as they tell you take that antibiotics for 7 days, please and please don't do anything about it. Just follow instructions. And if your doctor tells you take these antibiotics 3 times a day,
Thank you.
kindly do that. If they tell you take these antibiotics 4 times a day, they know why they are telling you to do that. Because it depends on how long these antibiotics spend in the body. We did have some antibiotics every 8 hours, they need renewal as soon as possible because every 8 hours they're out of the body. So when your doctor tells you take it 4 times a day, don't say, if I take it 2 times a day, it's the same thing. It's not in any way the
It's
same
not the
thing.
same.
So when the doctor tells you 4 times, there's a reason why for that 4 times. If it tells you once a day, do as so, don't take two. Because antibiotics, they work differently, they work in different ways. So you can't just say, okay, because my friend takes antibiotics once a day, I should take mine once a day. Because this particular antibiotics work for Mr. A, it's going to work for me.
So,
Because I used these antibiotics last time to treat infection, if I use it
and
on this particular infection, it is going to work. Let me tell you something, don't do that. When you visit a doctor and the doctor gives you antibiotics the first time, you took it, it worked. You may have another infection that does not necessarily require that same antibiotics. It requires another type of antibiotics. So you just have to be conscious of it. I know healthcare is expensive. I know consulting a doctor is expensive. But sometimes you have to look at what you tend to lose if simple instructions are not followed. All right. And also, this channel basically is for reproductive health. I've seen a lot of ladies when they have cottage cheese discharge, when they have smelly discharge, when they notice any discharges at all from their vagina, the next thing that comes to mind is to get antibiotics.
antibiotics.
Any discharge at all, the next thing that comes to mind is to run to the pharmacy and get antibiotics. Why? Because there is no control for antibiotics. So let me tell you something like what student Nurse Hope said. He said that if you are having a viral infection, if you are having a yeast infection, and you take antibiotics, it's not going to work. If you're having a viral infection, you're having a yeast infection, and you decide to, oh, I suspect, you're always suspecting, and you take antibiotics, it's never going to work. So when it's yeast infection, use anti-yeast medication. When it's a bacterial infection, use antibacterial, which is antibiotics medication. You may want to ask, oh, what is the effect? I want to abuse it. It's not, but if you continuously abuse these antibiotics, when you may need that antibiotics, it might
Yeah.
not work for you.
Okay.
Trust me. If you continue abusing these antibiotics, when you may need that antibiotics, it might not work for you. That is when you hear people saying, oh, this man is resistant to this class of antibiotics, this class of antibiotics, this class of antibiotics. They've given all the antibiotics, not working. And when in the hospital they gave you all these antibiotics and it's not working, your only option will be palliative care. Because the infection is going to deal with you mercilessly and it can lead to death because no antibiotics will be able to cure it again. So that is why we should not in any way misuse antibiotics. And for those, like he said, he used himself as an example, and that did not only teach you that, this also taught me too. Because sometimes I make assumptions. Then when I had access to medications, I feel okay, my doctor has given me these medications. If he did not finish, let me go and buy that same medication and continue using it. No. Speak with your doctor again. Let your medications be reviewed. Let the necessary tests be done. Then the doctor will tell you if they will change the antibiotics or continue with that same course of antibiotics. Please and please, this is a very important message. For those that have gotten it, hold it dearly. For those that have not gotten it, I pray you get it and don't abuse antibiotics. As the name implies, antibiotics is for bacterial infection alone. Antibiotics cannot cause HIV. For those that are using it as a preventative measures after sex. After sex, the next thing is to get bichaman piclos and to get I think bichaman is a common one.
Yeah, Andrew's
Andrew
liver
liver
salt.
salt, bichaman because they tell you to flush the system after sex. My sister, you are doing yourself more harm than good. Trust me. And I've seen ladies like in their pack, they have antibiotics, bichaman piclot. Anytime they have sex, they pick one of it. Just one. They are not even completing the full dose. They pick one antibiotics and take and tell you it's going to help me fight infection. Next time again, they have unprotected sex, they pick another dose, just one. They don't even finish the course of the antibiotics. If you finish it, that's even better. But this time, they just pick one tablet for one sex. It's not like Postino 2. When you want to prevent, you take emergency contraceptive, you take it and it's going to prevent pregnancy. They now take Bicham, if they take it with the mindset that it's going to help them prevent infection. If that person has HIV, it's not going to work. Trust me. So
Yeah.
that is why when he brought up this topic, I saw it as an interesting topic that we should involve him in. We are all young and we want a better future. So please, let's stop antibiotics abuse. And for the ladies that keep having current cottage cheese discharge, they keep having current inching in their vagina. Sometimes it's not sexually transmitted infection that's causing it. What is just causing it is just poor vaginal health. What are you using down there? Like I will always tell all ladies, if you are watching our video, the vagina is self-cleansing. Forget all those wash you see on the internet. Forget all those scented soap you see on the internet. The vagina is what? It is self-cleansing. It cleanses itself by itself. It doesn't need any soap. It doesn't need any fragrance. So for those that are very good at, oh, they said this is the best wash. I did not say you should not wash your vulva. You can wash your vulva, but leave the vagina alone. Stop doubting. If you have not been told, this video is also here to enlighten you about that. Stop doubting. Stop having that mindset, I am washing my vagina. No, you are not. You are only doing your vagina more harm than good. The vagina is self-cleansing. When you wash with soap, when you wash with chemicals, when you wash with anything, even water, what you are succeeding in doing is to alter the pH of the vagina. And when you alter that, there's going to be an increase in yeast infection. There's going to be an increase in bad bacteria. And that's when you hear women saying, oh, it's inching. I keep inching. I keep inching. I treated bacteria. I treated infection last month. Now I am still treating infection. I treated infection last week. What is actually causing it is what you are using to wash down there. So leave that place alone. You can use your feminine wash for your vulva. You can wash the outside, but when it comes to the vagina, leave it alone. Because if you continue, you will continuously have what? You will continue to have your yeast infection. This is an enlightenment video. If you are a man and you are watching this, share it to your wife, share it to your girlfriend. Because I've seen ladies walk up to me. These are girls, they are not sexually active, they are virgins, but they keep complaining that they have current inching. And they keep asking themselves questions like, oh no, Miss Mary, I don't know what I did. I am not having sex. I'm not even sexually active. How come I keep having this infection? I keep having what you are doing wrong is not that the fact that you're not having sex. What you are doing wrong is what you are using to wash it. All right. So you don't. Nobody is sleeping with you in the dream. Somebody told me that it's possible somebody is sleeping with me when I'm sleeping. No, nobody is sleeping with you. What is happening is what you are using to wash it. You are using what you are not supposed to use. The vagina is self-cleansing. You can wash your vulva, but when it comes to the vagina, leave it alone. Because when they keep having those inching, they keep taking antibiotics, not knowing that it's just the little things that they are using that's causing that inching. They keep washing, they keep having inching, they keep taking
Yeah.
antibiotics. And these antibiotics that you keep taking keep increasing the yeast infection.
Perfection, yeah.
It all started with you washing. When you are washing the vagina, the inching increases. Now the inching has increased. Then the next thing you now start seeing is antibiotics.
That is
Now you go and take the antibiotics. When you take the antibiotics now, you don't have bacterial infection.
perfection.
So the antibiotics now come again, increase the yeast that's already
Increase
there.
the
And you hear them saying next month, I treated infection last month. You are perfectly okay. Your vagina is self cleansing. That is why we are here to tell you to stop antibiotics abuse. Please, even for the men, that is why we have safe sex. If you can't stay, there's something called safe sex. That's why you have the use of condoms. Forget the fact that they keep telling you, I like it skin to skin, I like it that. That is why you have safe sex. If you like yourself, put on condoms. Don't destroy your future for 15 minutes enjoyment. For 15 minutes fun, don't destroy it. Because when you see people that come down with HIV, gonorrhea, they'll tell you, I made the biggest mistake in my life. I would have not. Instead of you to really regret later on,
yeah,
practice safe sex. Because it's just
yeah.
15 minutes, it's just 30 minutes. It's just, okay, let's say you are very good, it's just one day, and
One
you are going
day
to suffer for the rest of your life.
of your life. Oh, yeah.
So please and please, if you want to do, practice safe sex. That is why you have the condoms. All right? I'm not going to penalize you. Practice safe sex, please, because you have to be sexually responsible. Because if you're not sexually responsible, you are continuously going to use antibiotics. And when you continuously use antibiotics,
That
you
is.
continuously invite yeast infection and your body becomes resistant to more antibiotics. So this is what I have to share. Now, so if you have more things to share, say I have a bad habit. This is my microphone here. I didn't use it.
Okay. But your voice is very clear.
I
Your
have
voice
a
is
bad
very
habit of
clear.
always like keeping my microphone aside and just talking.
Huh.
I just remember that I brought it out. I was supposed to use it. But I didn't use it. I'm still getting used to it, sharp. All right, you can. If you have something to share, you can also share
Okay,
before we go.
okay. What I want to share is that in terms of women menstruation, most times um your the cessation of your menstruation does not necessarily mean you have a bacterial infection. So there are
Yeah,
many factors here.
I think I have to
I
do a
have a lot
shot
of
on
people
that.
coming to my DM to disturb me. I'm not seeing my flow. It's not flowing regularly. You know, you're gonna start running and you want to take antibiotics, and
I need
the
to type
cheapest
this
one there is
down.
that particular. So
I need to type it
please,
down. Sorry.
yeah, it's okay. Please, when you have cessation of your menstruation, all right, you need to at least run some tests to be sure. It can be as a result of hormonal imbalance, and it can still be as a result of other factors. All right, stress and other stuff. All right, yeah, it can still be as a result of infection. Menopause can still be as a result of a cessation of menstruation. So you need to meet your medical personnel, your doctor and your nurse to confirm, all right, to do some tests to confirm why you are no longer having your menstruation. Don't jump into antibiotics. It will do more harm than good. And I know why I'm emphasizing on this. All right, I have a lot of them who comes to me to ask me questions and all that. And this topic have been boiling in my heart because the next thing when you ask them which drug have you used, they will now start listing the drugs that they have been,
And
and there
then
will be no
funniest thing is
effect.
that they are listing strong, strong antibiotics.
Antibiotics like
Not
this
even
far.
the little, little ones, the strong, strong ones. I thought that they list the broad spectrum antibiotics that will kill all the bacteria, including the good ones in your body.
Like is I don't know, it's very horrible. And most times they don't even know the antibiotics they are allergic to. They keep taking maybe something like me, I'm allergic to erythromycin. All right. So there are some people they don't know what is allergy. They'll be taking an antibiotic, all right, and the thing will be causing headache, red eye, rashes in their body, and honestly, they will continue to take antibiotics, thinking that is the infection that
They'll
is
say it's
causing
coming
all this.
out.
They don't know
The
that
infection is they'll say,
coming out.
okay, yeah, I've seen that question. Somebody say, the antibiotics is bringing the infection out. So that's why the person is having rashes. God.
I don't know. Most times, all these things are allergic reactions. You need to be very conscious of how you take your drugs, and you don't stop combining drugs without knowing their contraindication factors. All right, you need to be sure. In short, don't diagnose yourself and don't prescribe drug for yourself. Please. There's what we call drug interaction. When they start interacting in your body, things might be getting damaged in your system and you will not know. All right. There are some drugs that when you take them together, they will cause kidney injury or liver injury. And you keep taking these drugs, these injuries will keep increasing. Before you know it, the kidney transplant is very expensive, not to talk of liver.
Hmm.
So let's be conscious of how we take these drugs.
It's okay
And
if you see somebody that will donate liver. It's only one liver that
that's
will donate.
another
Who will not
problem.
donate liver? And you know all these things now are like unprotected hepatitis. Hepatitis is
Yeah.
managed. It's not totally treated. It can be managed, but not
Yeah.
cannot be treated totally. So people need
Yeah.
to be aware, please. Okay.
Okay, that's all I have to say. Now, please let's be responsible while
And
taking
before
our
I end
antibiotics.
this video, if you have not watched our recent video, just watch. Just our advice you go and watch is actually a very interesting video, especially it's for the men in particular. If you are a man and you are watching this live video, I would advise you go and watch the video. It's very, very educative because I made a video on erectile dysfunction, and I found out that most men they are more interested in the size rather than the health of their penis. So if you want to know about how to keep it healthy, there is a video for you, and I would advise you watch. If you are a woman and you are watching, I would advise you to share this video, that particular video, not this one, to your husband so they tend to have an idea. Our reproductive health is not something we should be shy about. It's something we should easily communicate with a doctor when we are having challenges. Because little things like this in the future can lead to infertility. We can hear
Yeah.
that recently there's an increased rate of infertility.
Infertility. Yeah.
Infertility is increasing every day. And if it's not properly tackled, if you don't take care of your reproductive health, the future is waiting for you. And I believe most men, African men especially, that gets married, they want to have children. So please and please take care of your reproductive organ that is responsible for you dishing out sperm and getting a woman pregnant. Okay?
Pregnant.
So that is all I have to share. Do you have anything to share? One end of video. We've tried for today.
Yeah.
I think
Yeah.
we
I've
all
already,
we all we all must hope
please let's.
a lot of data.
It's
Yeah.
okay. Please, I don't know whether there is any question. Please, you can
Let's see.
ask
Is
your
there any
questions.
question?
So that we can attend to it before we go.
If there is any question, kindly drop in the comment section. We'll be going off soon. Is there any question? If you have any question, kindly drop in the comment section. We've spent approximately 49 minutes. Going to like 50 minutes. Let's give them 1 minute. If there's no
Okay.
question, we'll end the live video. Oh, we've tried for today.
Yeah.
If
Please,
there's no
while
question,
we are
we are ending the video. Okay, you want to say something?
okay, while we are waiting for the questions, please let's be conscious of our health. All right. Let's not be too sensitive. That small thing that will happen to you, maybe some allergic reactions. You want to go and take antibiotics, please. Just we have a question, please.
Gift Unjoku, can you answer that question, Hope? It said, which
Okay.
antibiotics are harmful to the body?
See, antibiotics can be beneficial, all right, and it can also be harmful to the body. All right. There is no antibiotics that I will mention to you now and say this one is more harmful to the body. All the antibiotics have their mechanism of action and they have their strength. All right. So before you take any antibiotics, please, you should meet your doctor, do some laboratory examination. All right, to find out the kind of infection that you are having, if it is a bacterial infection or not. All right. If it is a bacterial infection, your doctor will go ahead and prescribe an antibiotics that will treat that particular infection. Oh, remember that all these drugs are chemicals. All right. They are chemicals. So when it is abused, they become very toxic and harmful to the body. So let's understand that. Nurse Miss Mary, you can add something, please.
Okay, in terms of antibiotics, generally, antibiotics are not harmful. They are beneficial. They
Yeah.
are beneficial to the body because they help you kill those bacteria in the body.
Yeah.
What is harmful is the abuse of it.
Okay.
We've
Yeah.
explained what we mean by abuse, taking without prescription, taking those more than what they ask you to take, taking less than. We've explained everything about what is just harmful about antibiotics is the abuse. Because when you abuse it, like we earlier said, on the long run, it's going to cause antibiotics resistance in such a way that when you need a strong antibiotics, your body it will no longer work, and the
Yeah.
only option might not be nice. All
Yeah.
right. So antibiotics is good. Be it azithromycin, be it lithium one ampicillin, amoxicillin, clarithromycin, all of them are helpful. But the abuse of these antibiotics is
Antibiotics.
what is dangerous to your body system. Okay?
And also, you have to be sure that the one your body accepts. All right, talk to your doctor. All right, because there are some people that are very allergic to some certain brand of antibiotics. All right, so it can be harmful when you are allergic to it. Not Miss Mary. It can be
Yeah.
harmful when someone is allergic to it. So
And
you need
if
to
you
be
are
very sure.
taking antibiotics and you see rashes, your eyes are red, it's not the
Please
infection
stop.
that is coming out. Please, you are
Yeah.
allergic to that medication.
Yeah,
So if
please.
you are taking any medication and you are seeing rashes in your body, your eyes are red, you are
Excessive headache.
shivering, your body is not like, just know that you are allergic to that type of medication. In the UK here, they really take into cognizance allergy. Like before you give any medication, you ask, are you allergic to this particular medication?
Yeah,
If you've ever had any reaction to this particular medication, they
please.
consider other brands
Yeah.
to give you.
Yeah.
Except there is no option, they now weigh the benefits against the effects. Okay, so when you start seeing rash or you start seeing something, you start acting strange after taking a particular medication, it is something you should ask your doctor for a review. All right. Somebody
That's
says,
the second question. Yeah.
he said, which antibiotics is good for body rash? Do you want to answer it?
Not Miss Mary. The person who is answering the question, please.
It doesn't really matter. It's a
Okay, please. You don't need to start taking antibiotics because you're having rashes, please. You need to be sure. You need to go meet your doctor. All right.
what is
Do
causing
text
that
now. That
rash.
is what we are saying. You cannot just start taking antibiotics because you have rashes now.
The rashes might just be the water you used to bathe. The rashes might
Yeah.
just be heat. The rashes might just be something else. But before you take antibiotics for rash, please see the doctor.
You see the
Rashes
doctor,
is not
please.
an indication for antibiotics
Antibiotics,
because you might
please.
think that rash will just come. Sometimes some rashes come and they go on their own. But if
Yeah.
it comes and you decide to take antibiotics, you will feel it's the antibiotics that made that rash to go away.
Okay.
But not knowing that you've already started building resistance for antibiotics with what you have taken in your body. Okay? In your inching and redness, where are you getting the
Yeah.
inching? Where are
Me
you
too.
getting the redness? If it is allergy, it should go before 1 month. But if it persists for months, please, what should one do after you have used a lot? Okay, Eniola, I think you've not been on this video since. I think I have to explain something to you, Eniola. We said in the video we've explained everything about antibiotics abuse. If you are okay all over the body, speak with your doctor. That's what I advise. Speak with your doctor for review. Sometimes it may be the doctors might refer you to a dermatologist. Maybe you're having some skin reaction. You are reacting to your body cream, your body soap, and your environment. So, what I would advise when you're having rashes all over your body, don't take antibiotics,
I
please.
think, yeah,
Don't, don't go and speak with your doctor. Okay, they are in a better position to tell you what to do. What they have to find out is what is causing that rashes. They will have to check because you see, it's rashes. There are different types. How is it appearing? Is it swollen? So you can't just say rashes. So that is why you
they
need the
reddish,
doctor to
all
review
those
it.
things.
Please
Yeah,
don't just take antibiotics because it might only get it worse. What I advise you in your last, speak with your doctor and get attend to know the cause of the rashes. Then the doctor will be in a better position to give you some medication. If antibiotics is needed, your doctor will tell you. But sometimes antibiotics might not be needed. They might just give you some creams, some cream to rub in it, and they tend to go away. Maybe it's a
yeah,
fungi. That's rashes is a fungal infection. They might give you some antifungal cream to rub on it. Okay, they might give you some antifungal cream to rub on it. So please and please don't take antibiotics. If you are watching and you have rashes all over your body, don't go and start taking antibiotics. Speak with your doctor. If need be, they'll refer you to a skin doctor, which is your
yeah,
dermatologist, to get it sorted out. Okay,
yeah. Please,
please, if you are watching this video and you've not clicked on the like button, kindly do so. We've tried a lot. We've explained a lot of things in this video. Kindly like. We should get this like up to 20. We have 17 likes alone for all this 1 hour talk.
I don't know.
Please,
Please
if you
like
are
our video,
watching, just
please.
click on the like button. It's going to go a long way to show that our videos are appreciated. I think Enyolana understands. She says, "Thank you very much, ma'am."
Thank you.
I think that's the only question we have. We've
All
tried almost an
right.
hour. Please click on the like button. We have 10 people, 9 people. Click on the like button if you have not. It's
Please,
not going to take
there's a
anything.
question, Miss Mary, before we leave this thing. Someone is asking, please, which antibiotics is good for left side kidney infection?
Where is it?
And
Let
that
me see
is
that for you.
Gainer James.
Why am I not seeing
Top,
it?
top side. Just screw up. There are a lot of questions above, please.
Okay, I've answered those
I
ones,
wanna,
except this,
okay,
which
okay,
kind
you
of
have answered
is
them,
good
please.
for left side kidney infection. How did
Okay.
you know you have kidney infection? Please, I didn't see that question. I've not answered that particular one. How do you know you have kidney infection? Forget though, you have to speak with the doctor if you have kidney infection. Oh. Don't assume you have kidney infection. If you have kidney infection,
Okay.
you're not supposed to be talking to me.
I
You're supposed
don't
to be
know.
talking to your nephrologist, your kidney doctor. You have to speak with him. He'll be in a better
Yeah.
position to tell you the type of antibiotics
Uh,
to
uh,
take.
yeah, and someone that have kidney infection should not be using any antibiotics because it's
You
going to
should,
create a lot of
yeah,
place.
you should
Be
not
very
use that
careful.
to play. Kidney infection is a big
Yeah,
infection, oh. Ah,
yeah.
we
To
don't
avoid
want
kidney
kidney
failure,
transplant.
please.
Run
Yeah,
to your
please.
doctor fast.
Wrong, wrong, please.
Okay,
See you
somebody
next
asked,
person.
is it normal for a lady approaching 30 to take supplements? And which supplements are good for a lady approaching 30?
Must miss me.
Supplements.
Can
What
answer.
kind of supplements are you talking about? Let me tell you something. That it's good to take some supplements, some vitamins. But sometimes you as a human, your body has excess of that particular vitamin. And when you keep taking that particular vitamin, there's going to be that particular vitamin overdose. For example, I have vitamin E in my body enough and I end up taking vitamin E every day, I might end up having excess of that particular vitamin in my body. So generally what I advise, try and get your vitamins from fruits, from vegetables, from the food you
Yeah.
eat. Okay? Sometimes I'm a victim of it, you get. But here I take vitamin D supplements because I know we don't have enough sun here. So even doctors advise you take vitamin D every day because especially those that are from Africa, we're exposed to good sunlight. But over here, we don't have that regular sunlight. We don't have it regularly. So it's advisable we take vitamin D. You have to know why you are taking those supplements. It is not that whether you are age, you are 40, you are 50, it's not advisable for you to just sit down and start taking supplements. But for the supplements I know that is good for old age generally, when you are like 30, 40, is the supplements that are good for bones, to make your bones
Yeah,
stronger,
calcium and all that. Yes, for sure.
especially for the women. Because when you are growing old, then you are prone to osteoporosis,
Arthritis.
arthritis,
Yeah,
things
yeah.
like that, weakened bones, weakened joints. So it is advisable you take supplements that are good for your bones, such as your calcium, vitamin D, calcium and vitamin D. Those are the supplement that is advisable for bones. But these days, women take vitamin C and other vitamins for skincare protein and skincare products. So I'm not really an expert in that field
In that
to
area.
tell you what and what to do. But I know some ladies take vitamin, they take injections to keep their skin glowing as they tend to grow old. So I'm not an expert. I don't take vitamin for glowing skin. All I know I take daily. Sometimes I miss it. I miss my dose ahead. What I know I take is vitamin C, which helps to build immune system, and I take vitamin D, which is good for my bones because I know where I am. There's no enough sun that helps with our normal metabolism of things that we need. So what I personally take daily is vitamin C and vitamin D. Sometimes I miss my dose, but I just try as much as possible to catch up whenever life comes back. So I have the effervescent one. So I only put it inside water. So with that, I am able to take enough water alongside with the vitamin. So I'm taking more water. And if you are taking vitamin C, you take a lot of water. Because if you take vitamin C with less water, it can predispose you to kidney stones and all that. Okay.
Yeah.
Okay, some he said I do take folic acid without prescription from my doctor. I don't know if he said, are you trying to get pregnant? Why are you taking the folic acid? Is your hemoglobin down? Is that your blood levels are they down? So why are you taking the folic acid? Are you trying? Most women they take folic acid because they want to get pregnant. Okay, so you have to know the reason why. Though folic acid does not make you get pregnant, it only prepares you to welcome the baby. So the baby has
Yeah.
a lot of blood supply, and
Bro,
you, as a
yeah.
mother,
The
has a lot
baby
of blood
minute. Yeah.
supply. So that is why it's advisable if you are trying to conceive, you take folic acid. Not that folic acid is generally responsible for pregnancy. It only prepares your blood so that it can circulate to the mother and the baby. So if you are not trying to conceive, I see no reason why you should take folic acid for me, except your hemoglobin is down or something you spoke with a doctor about. Somebody said, is it safe? This is usually my questions. That's why I'm not asking hope to review. Is it safe for a lady to take contraceptive after 6 days after 6 days of direct sex during her ovulation? Do you want to answer, Hope? Or I should answer?
No, go ahead and answer, please.
Okay. He said, is it safe for a lady to take contraceptive after 6 days of direct sex during her ovulation? After 6 days, you take that um, emergency contraceptive, it is not going to work. Okay? Emergency contraceptive, which is Postino 2, can work well within 72 hours. That is 3 days. But as the hours increases, the effectiveness decreases. It's more effective when you take it within 24 hours. When it
Yeah.
becomes 48 hours, 72 hours, the effectiveness decreases. Okay? So for that s- having sex 6 days and taking contraceptive, it's not going to work. If you are ovulating and the mass sperm is strong enough, what I would advise you to do, if you miss your period, do a pregnancy test and see the outcome. Okay? There's somebody asked, how often should a lady go for infection test even without signs of infection? I see no reason
Okay.
why you should go for infection test when you don't have signs of infection.
Signs and symptoms. But yeah.
When you don't
But
have
not Miss
signs,
Mary. Okay. Not Miss Mary. Regularly, please go after 3 months. Be going for HIV test if you are having unprotected sex, please.
yeah, yeah. So for me, generally, that's HIV. If you are having
Yeah.
unprotected sex, for me,
Sex,
generally,
yeah.
if you are not showing signs and symptoms of an infection, I see no reason why you should go. As far you are not having unprotected sex. But if you are having unprotected sex,
Unprotected
please see your
sex.
doctor. every 3 months, please.
Yeah,
If you
that's
are not having unprotected sex, there are no signs and symptoms of infection. Chillax, eat well, and live happy.
and enjoy
You
your
don't need
life.
to go
Yeah,
and waste your money doing laboratory tests or waste your time waiting for your turn to get some tests done. That is my own advice. Okay, if you are not having any signs, no itching, no discharge, you are okay. Please don't visit the doctor. Don't waste your money.
don't
So
waste your
that's what
money.
I
Yeah,
advise. Okay.
and keep a good personal hygiene in terms of your toilet because you still
Yeah.
have UTI. Yeah,
Personal hygiene. If you are not having sex, there's also urinary tract infection
track
that
infection.
can be gotten
Yeah,
from the toilet, dirty pants, dirty undies, lack of proper hygiene, washing your vagina with soap, things like that.
yeah.
So that cause yeast infection. So you just have to be careful. Okay. Any other question to take? Please let's get this like to 20. For those that are watching, can you click on that like button? Please. Please don't be stingy
Don't
with
be
the like.
stingy.
Don't be stingy with the like. Any other question? Any other question? I think we've answered all. Oh, 20 like. That's
Twenty now.
better. It's better. At least we've tried. We've tried. 20 like is not bad. You can even make it 25.
Yeah. Yeah.
Okay, somebody asks, is it okay to take probiotic as a lady? What are the effects of probiotics to women? I think this gift, this particular question needs a full video. I need to research
Now,
on it because I went to a conference where a man was talking about probiotics, and it was
okay.
like too much of it is not good. It's not advisable you even take probiotics because of how it's been made and everything. I can't really give any useful advice in regards to this probiotic now. But what I can promise you is that I can research more on it, study about probiotics, and make a video on it.
Into
Personally, I don't take
yeah.
probiotics, so I don't really know how it works. I don't know what it does. So what is going to happen? I'm going to make a video on probiotics. I will study on it, then make a video on probiotics. I'll just write it down after the videos I'm going to make. So that's what I can do, gifts. I don't have any idea. Then John Paul Ugu said, thank you for the answer. Her ovulation just ended yesterday. Can I do the pregnancy test now? No.
You have to
No,
wait
no,
for
no.
2 weeks now.
For you to do a pregnancy test, you have to wait
You have to
14
wait
days
for
after
two
sex. 14 days after sex,
after
that is
sex. Yeah,
when you
that's two
do
weeks.
a
Yeah.
pregnancy test. If you do a pregnancy test now, it's going to show
Now it will
negative,
show
and you'll be
negative. Yeah.
happy not knowing that something is there, if something is
Mm.
there. So, what's advisable to really know if a lady is pregnant? 14 days
At
after
least.
sex, that is the ideal time to do a pregnancy test, or preferably when she misses her period. You
Yes.
can try
And,
doing a pregnancy test.
and please let the person avoid alcohol and all those alcoholic drinks
My
because
thoughts
something can be
abortion.
there and alcohol can displace it too. So
Eh?
because something can be there and alcohol can displace it too.
Yeah, so avoid alcohol. If you want the baby,
Yeah.
avoid alcohol.
Yeah.
I'm not saying alcohol is an abortion too. Oh. You might take alcohol and the baby will still be there. Oh, please. So that they don't go and say, oh, I just had a tip. When you take alcohol, it might displace the baby. Before you know, somebody's going to get drunk tomorrow in
That,
your neck, in front
yeah.
of my neck. You were the one that said it. So don't be. Somebody's going to get drunk tomorrow and say they are trying to remove a baby. So,
Of course, I have seen people doing that, taking all these
gin,
ogogoro,
dry gin.
putting this thing inside it. Now people are
Yeah,
taking risk.
putting that
Honestly, I don't know. I
what we've
don't know.
really seen, I wanted to express it.
Because
Pitching is the best way to really express what I've seen. So no contraceptive can stop pregnancy after 6 days. Uh, there's no emergency contraceptive which is not going to
that
work after 6 days.
yeah,
The best thing, if you are a lady that usually have sex, what I advise, you can put postinator in your purse, even though you are not sure of yourself. Always take postinator alongside with you in case something happened. And you know, and something I want to clarify, I've been clarifying it almost all my live video. If you take postinator when you are already ovulating, when you've already released that egg, it's not going to work.
it's not going to work. Yeah,
The belle will come, even taking emergency contraceptive quickly. All right. If you take postinator immediately, even when as far the egg is released, you take postinator. It's not going to work. You are going to get pregnant if the egg is there. How many months in 10 weeks pregnant? Somebody that is 10 weeks pregnant is 2 months and 2 weeks pregnant.
Yeah.
I hope I understand your question. Now, see, YouTube usually have a lot of questions compared to
Wow.
Facebook.
Yeah.
It's
It's
usually more.
actually nice. It's nice. Yeah.
It's
More than
actually
Facebook.
late.
Yeah.
Sometimes you can get as high as 60 people watching, asking
Yeah.
questions. But Facebook, we are trying to build a Facebook community.
Yeah.
They say, how many months is 10 weeks pregnant? Is 2 months and 2 weeks pregnant? Then, please, when we vomiting stop? I can't really say when vomiting will stop, but generally, the first trimester, which is the first 3 months of pregnancy, is where
Hmm.
most women experience that nausea, vomiting.
Yeah.
Then during the second trimester, that's from the fourth month, things tend to reduce. But different body system with different ways they react to things. So some people they might have vomiting throughout. Some people they might spit throughout. Some people they might have nausea throughout the 9 months. But some people the first 3 months they experience that. Then during the fourth month they are much better. So it just varies. So you can't really say because my friend is not vomiting, I'm not going to vomit, things like that. No, it just changes. It varies, depends on individual difference. Okay, Ahmed Yetunde, I believe your question has been answered. Any other question? Mm, 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 mm. So I think I have to go. I can't wait. I almost ended this live with it was hope that I said let's wait. I almost ended the live. So it was like let's wait and see if there's any other question. So if there is no question, permit me to go off now. Okay? Unjaku, I can't really say. I don't know. I don't know. I don't know. I don't know if there's a particular fruit that is good for someone with enlarged prostrates. I don't have idea about fruits and enlarged prostate, so I can't really say. But I know fruits generally is good for the body. But I can't say which particular fruit is good for prostate enlargement or not. So I can't say that. All right. I'm going off now. All right. I'll try as much as possible to come online. It gives me great joy to take your questions. So I'll try as much as possible to come online frequently, take the questions I cannot make videos on so that others tend to be informed about it. So we'll be going off now. Thank you very much, everybody. I really appreciate you for coming. See you in our next live and also our next video. If you are a man and you want to know how to take care of your penis, all you have to do is to watch our last video we uploaded. Bye and see you in our next live or our next video.